All right, folks, my name is Aiden Pierce, and I'm just going to go through how to apply a thermal agent to a patient. Today we're going to be talking with, his name's Jake. He fractured his patella 6 weeks ago, and so now he's coming to the clinic and do some work with him. Currently, we know there's the 3 stages of healing, which is inflammation, proliferation, and maturation. Currently, he's in that maturation stage where we're just trying to realign those tissues and increase the rate of healing and get him back into a functional state. So some of the indications for thermal healing, the reason we're doing it is to enhance the response of connective tissue for manual therapy and manual treatment. He's also lacking some range of motion, specifically in knee flexion. So a thermal agent can help facilitate and improve that. It's also going to help with the healing process in general, move through that maturation stage. And it's also going to help with subacute pain. We don't want to use thermal agent for acute pain, but since we're in that subacute to chronic stage, this thermal agent will be perfect for him. And then some contraindications that we want to make sure we go over is we want to make sure he doesn't have, again, an acute musculoskeletal condition, which we know he does not. We want to clarify that he doesn't have any circulation issues or vascular diseases. We want to make sure that he has good sensation on the skin, so no skin anesthesia. And obviously that we're not applying it to an open wound or an edema. So that's that. So now we'll move over to the patient, Jake. All right, Jake. So like I said, can you see me? I'm just gonna put a hot pack on your knee. Do you know which knee it is?
It's my left knee.
Your left knee. Perfect. Your left knee right here. We want to put heat on because we know you're in some pain right now. We know that we're still trying to go throughout this healing process, and so heat, a thermal agent, is going to improve that. It's going to help relax the tissue as well, which obviously is important. And you know how we've been working on that range of motion for bending your knee. It's also going to help improve that range of motion. So that's the reason we're going to be doing it. We're going to be doing it for 10 to 15 minutes on your knee. I'm going to give you a timer, and I'm just going to have you sit there for 10 to 15 minutes. One thing that's important is I want you to not sit through it if it's hurting you. Obviously, it's going to get a little warm, but we don't want it to burn. We don't want it to cause any pain. So if at any point it's causing you pain that you can't go through anymore, take it off, get up, or call over and I'll come help you. But I just want you to make sure you're not sitting through that and suffering through that, okay? And then I think that's it. I think we're ready. I'm going to apply in this hot pack. We're going to have 6 layers and a towel between your skin and the hot pack. Obviously right now you have pants on, but we'd prefer it to be skin on skin. So we'll do that, and I think we'll move on from there. Does that all sound good to you?
Sounds great.
Do you have any open wounds or any loss of sensation or anything that I should know about?
No, I can feel it.
You feel okay?
Yeah.
Awesome. And no vascular issues or anything like that?
Nope.
Okay, perfect. So I'll set this up. So we have our hot pack in here. Obviously we have 6 layers on top of that. So I'm going to set that here. Oh, first I'm going to get that towel. Where'd the towel go? Right here. I'm going to put that towel on so we're not getting the hot pack dirty. And then important thing is as well, Jake, is I want you to feel compression, right? I don't want there any loose spots. I want you to feel tight and snug so it's really getting some good heat on that knee. Okay, so I'm going to just try to tuck this under a little bit. Obviously like that. Does that feel snug? Does that feel compressed?
Yeah, it feels tight.
Feels tight? Perfect. That's how we want it. And then I'm going to get this timer here. Set it here for 15 minutes for you. We're just going to let that go. Again, if you feel any pain, feel any burning that's outside the norm or what you can handle, take it off. We'll go from there. Does that all sound good to you?
That sounds great.
Okay. We'll jump forward 15 minutes later, say that timer went off. Perfect. Come back over. Jake, how are we feeling?
Good. I'm really good.
Perfect. How's that heat feel on you?
It felt good, yeah.
Yeah, no burning or anything?
You know, I'm feeling loose.
You feel loose? You feel a little bit better?
Yeah.
Has that pain gone down at all?
Maybe a little.
A little
I mean,
bit?
It still hurts a little bit, yeah.
Okay, perfect. Well, as long as we're seeing a little bit of improvement. Do you mind if I look at your knee just to make sure there's no burns or anything like that?
No,
that we
that's
don't
fine.
want?
That's fine.
It all looks good to me. You have my sign of approval. I think that's it for today.
Wonderful.
Awesome.
Thank you, Dr. Aiden.
Thank you, Jake. Hope you feel better.
I will try.